With the patient in dorsal recumbency, clip and prep the area over the midline. Make a skin incision halfway between the umbilicus and pelvic brim, approximately 3 cm long. Bluntly dissect the fascia to reveal the muscle layer. Be aware that cats are usually thin and have little subcutaneous tissue to dissect. Locate the linea alba, which is the thin white line in the ventral midline. In well-muscled or fat dogs and cats, the linea alba may be only identifiable as an indentation. Pick up the linea alba with rat-toothed forceps. This ensures a gap is formed between the linea alba and underlying abdominal organs. Access to the abdominal cavity is gained by making a stab incision with the scalpel blade facing upwards. Place blunt tissue forceps into the incision and turn them to run horizontally beneath the linea alba and parallel to the body wall. Carefully extend the abdominal incision with blunt scissors by running them between the elevated arms of the forceps. This ensures that the scissors are above the abdominal contents and unable to damage them. Make sure the abdominal incision is the same length as the skin incision. With the index finger of the right hand, locate and retract the bladder caudally. With the index finger of the left hand, push all the abdominal contents cranially. What is visible in the space between your two fingers is the bifurcation of the uterus. Ensure the structure you locate bifurcates. This will prevent inadvertent ligation of other structures which may have a similar tubular appearance, such as ureters. Once the uterine body is located, elevate it slightly and follow the left uterine horn cranially until you locate the ovary. Gently grasp the ovary between finger and thumb and retract caudally using gentle traction. This is usually easy in cats as suspensory ligaments are easily stretched. Exteriorize the ovary and make a window in the broad ligament with forceps. Apply clamp 1 with a crushing action proximal to the ovary. Place clamp 2 directly distal to clamp 1, still ensuring it is proximal to the ovary. Place clamp 3 distal to clamp 2. Remove clamp 1 and ligate in the crushed area. Once you are satisfied the ligature is secure, hold clamp 2 still and rotate clamp 3 clockwise half a turn, and then return to the original position. Gently peel away clamp 3 from clamp 2, ensuring no movement occurs in clamp 2. Tearing these structures results in spasm of the blood vessel walls and is less likely to hemorrhage than using a scalpel or scissors, which create a clean cut. Once the ovary is separated from the ovarian stump, grasp the tissue beneath clamp 2, above the ligature, with rat-toothed forceps, and remove the clamp. Lower it carefully back into the abdomen and check for hemorrhage. Repeat the process for the right uterine horn. Once the process on the right uterine horn is complete, exteriorize the uterine body and identify the cervix if possible. Ligate prior to attaching the clamp if the patient is in season, as the uterine body is very friable at this time. If the patient is not in season, apply clamp 1. Apply clamp 2 directly distal. Remove clamp 1 and ligate in the crushed area. Apply clamp 3 above clamp 2 and rotate, holding clamp 2 still. This separates the uterine body from the stump. Grasp the uterine stump with rat-toothed forceps. Remove clamp 2 and check for hemorrhage. Once satisfied, lower it back into the abdomen. Close the midline incision using simple continuous sutures for the linea alba and subcutaneous tissue. Use cruciate, simple interrupted or intradermal sutures for skin closure.